my name is Arlene Paiste. I'm your SPN treasurer. I'm an RN at Mary Birch on the postpartum unit. So management came back today and they talked about compensation and the no cancellation proposal that we gave. The compensation shows no respect to us nurses that are dedicated to Sharp Healthcare. It doesn't show that they want to retain nurses at all. They went up 1% from their last proposal to our counter. Sharp is disrespecting our commitment to our patients.
My name is Jan Hodgson. I work at Sharp Home Care and I've been a nurse at Sharp for almost 28 years. Well, Sharp came back today and we talked about cancellation and on-call. Right now they can only cancel you 5 times in 6 months. One of the takeaways that Sharp is asking or proposing is that it would be 8 times in 6 months. So that's even more cancellation that we already have. So this is a big concern for nurses, that they would be canceled more times than they're already being canceled.
We're not going to go backwards. We should really define what a cancellation is, and we definitely don't want to increase the amount of shifts that they do.
We're asking Sharp to not cancel us. This has been a big thing. A lot of nurses have been canceled over and over again. It hurts them, it hurts their families, and ability to pay their bills and live. And we've asked Sharp for no cancellation. Sharp says that's not possible. It's going to cost them $12 million to not have a cancellation. Even if it did cost them $12 million, I think they could afford it. Other hospitals in this area have no cancellation. They seem to be able to make it work. I'm hoping that we can get some movement on this issue. I think retiree benefits is a big issue. Being able to have your health insurance if you retire after 55 is a big concern. It's important to nurses who have spent their whole career working at Sharp, giving to the Sharp experience, taking care of patients who are sick, and now they've come to the end of their career and they want to be able to retire and have health care for themselves. And we talked about the wear and tear on a nurse's body after many, many years working as a nurse. Management seemed to kind of discount that, and that was kind of upsetting to us. It's like, you know, you've spent all these years taking care of patients, helping patients recover, helping patients die, whatever it is the patient needs, and now here you are, and you need a break. You've done your duty as a nurse, and now you can't get health care for yourself.
Our nurses don't have enough to retire on. We have a lot of nurses that do just like working for Sharp, and they're dedicated nurses. But in the end, after 25 plus years working here, they really don't have anything to live on after retirement from here. Not like at the other big hospitals around here in San Diego. Again, it's another thing about retention. I keep hearing about nurses that have left and they've gone to Kaiser, they've gone to UCSD. You know, there's more pay, there's more benefits for them. In the end, being a dedicated nurse here at Sharp, we would like to have more benefits for when we retire.
I don't think we're asking anything more than other hospitals in this area are providing for their nurses. And we're losing nurses because of that. If other hospitals are providing more benefits, better retirement, things like that, we are losing nurses. Sharp doesn't want to believe that we're losing nurses, but I'm sitting at a table of nurses throughout the whole Sharp system telling story after story of how they train nurses and then they leave, and it's just a revolving door of nurses getting trained at Sharp and moving somewhere else because they're getting a better deal there. And that's bad for patient care. If we're losing nurses that we've trained to go somewhere else, and we're constantly over and over training new nurses and a revolving door of nurses, that's not good for patients either. And that's important to nurses. Patient care is very, very important. And it's important to Sharp.